We'll start by providing an outline of obesity, and then move on to Johnson & Johnson's efforts on obesity, and lastly, potential technology in this area. So obesity is a term to describe someone who's very overweight with significant excess fat. For most adults, a BMI of 25 to 29.9 is considered to be overweight, and a BMI of more than 30 is considered obese and at risk of obesity-related diseases. Modern lifestyle often promote eating excessive amount of cheap, high-calorie food and spending a lot of time sitting at desks, on sofas, or in cars. So this is a common cause of obesity. Some common life-threatening conditions are type 2 diabetes, coronary heart disease, stroke, and cancer. Today, roughly 2.1 billion people are overweight or obese, which is nearly 30% of the world's population. That is 2.5 times the number of people who are undernourished. Although the global cost and economic impact estimated to mitigate obesity is $2 trillion, it is important to consider the measurement of obesity, as the number of people categorized as obese may be under or overestimated. The BMI does not take into account the person's body fat and muscle content. Even though a pound of fat is the same as a pound of muscle, it takes up 4 times the space of muscle tissues. So even if two person has high BMI, may weigh the same and have the same height, one may be overweight and the other may not. So as fat tissue take up more space than muscle tissues, it may be more accurate to look at their horizontal dimension, which is their waist circumference, than their weight. In the article, The Health Risks of Obesity, Better Metrics Imperative, it is suggested that the weight to height ratio may be a more accurate way to check obesity. A study by Rand Corporation shows that waist size explains the higher type 2 diabetes in US than UK, not the BMI. Johnson & Johnson saw an average of 5% increase in annual revenue between 2004 and 2014. Johnson & Johnson has 3 main type of products: pharmaceutical, consumer products, and medical care and diagnostics. If you look at treatments for obesity-related diseases, Johnson & Johnson covers 2 areas: the pharmaceutical and medical care and diagnostics. Under pharmaceutical, canogliflozin brings in a revenue of $5.6 billion last year, and bariatric surgery brought in $2.142 billion to Johnson & Johnson last year. The revenue for obesity-related diseases accounted for 10% of Johnson & Johnson's total revenue in 2014.
Johnson & Johnson's R&D expenditure on obesity-related products have risen by 24% in the last 4 years. The type 2 diabetes drug has shown strong efficacy in reducing blood sugar level. Whilst the potential of the drug is much higher, we currently expect the drug to achieve over $1 billion in expected peak sales. With obesity on the rise, diabetes is affecting more people every day globally. In the US alone, roughly 26 million people suffer from the condition. Owing to these factors, the global diabetes drug market has seen rapid growth in the last couple of years. The type 2 diabetes drug market, which constitutes a significant chunk of the total diabetes drug market, is expected to grow from $26 billion in 2011 to $50 billion in 2021 in developed markets including the US, Japan, and Europe. With regards to obesity, Johnson & Johnson provides 2 main services. These include prevention schemes and treatments. Let's focus on the treatment of obesity-related diseases from Johnson & Johnson. Treatment can be divided into 2 subcategories: pharmaceuticals and surgery. Both of these treatment schemes only provide deliberate and immediate help to the patients. Let's narrow the focus down into different types of surgical procedures in dealing obesity. There are 3 most common types of bariatric or weight loss surgeries. They are gastric banding, gastric bypass, and sleeve gastrectomy. Gastric banding is a type of restrictive surgery that shrinks the size of the stomach, which reduces the amount of food it can hold. The procedure involves the sewing of a silicone and a elastic band around the top of the stomach. A balloon around the inner surface of the band is connected to a tube that leads to a $half-sized port above the abdominal muscles but below the skin. This makes you feel full when eating much sooner than you did before surgery. Gastric bypass includes 2 steps. First, the physical size of the stomach is reduced. The surgeon will use staples to divide the stomach into a small upper section, called the pouch, and a larger bottom section. Next, a small part of the patient's small intestine, called the jejunum, is connected to the pouch. The food consumed will travel from the pouch into this new opening, resulting in less calorie intake by the body. Gastric sleeve is a procedure that is performed by dividing the stomach to create a long pouch that connects the esophagus to the small intestine. The pouch is stapled and the rest of the stomach is removed. When comparing the weight improvement, 12 months after the surgery for all 3 surgery types, gastric bypass in general performs the best, followed by sleeve gastrectomy and then gastric banding. The following graph shows a percentage of people in 80, 50, 20% increments who were able to lose a certain amount of pounds and reach potential weight goals.
Moving on to the latest technologies that Johnson & Johnson is working on, I want to elaborate on J&J's innovation centers. There are 4 of these existing right now, and a significant part of Johnson & Johnson's R&D investments that Sam mentioned earlier flow into these innovation centers. Where often together with small specialized startups, J&J is advancing the development of new healthcare solutions in both the pharmaceutical and medical devices and diagnostic sector. And this is important because 25% of Johnson & Johnson's revenues are coming from products that were launched in the last 5 years. Now let me go into more detail with who J&J is working with in the obesity space. Starting with the pharmaceutical sector, Johnson & Johnson have established a collaboration with the biotechnology company Energesis, which is identifying biological compounds that stimulate the formation of brown fat for use in treating metabolic diseases. The company's approach is a novel strategy leveraging recent insights into brown fat biology to increase the body's ability to burn stored fat and lower insulin resistance. This technology is one of the first to enable the development of drugs that increase energy expenditure and could help to address both obesity and diabetes. Moving on to the second company, which is called Navitor. Now they are developing highly specific modulators of the pathway that is primarily responsible for cells' response to nutrient availability, including cell growth, which is called mTORC1. Navitor is leveraging the central importance of this mTORC1 pathway to develop new therapies for metabolic diseases such as diabetes. Performing a quick analysis on the customer sentiment on Navitor and its technology indicates that customers have a primary positive sentiments towards this company and their technology. Moving on to the medical devices and diagnostics section, there is a very interesting company called Achtel Therapeutics that Johnson & Johnson have invested in. Achtel is working on developing novel growth factor related therapies for cardiovascular diseases, including heart failure. Achtel work builds on research conducted at the Harvard Stem Cell Institute and the Brigham and Women's Hospital, and essentially their technology is about cardiac remodeling. Now, in contrast to the before-mentioned sentiment analysis on Navitor and their technology, it seems that cardiac remodeling is something that customers are more skeptical towards.
Prevention is a significant part of obesity management with huge potential market waiting to be explored by governments and medical companies like Johnson & Johnson as well. According to McKinsey report, prevention has been regarded as the most cost-effective way to deal with obesity, especially for long term. This is a research from McKinsey shows different interventions groups and the estimated cost and the relevant effectiveness. It is clear that those prevention-related interventions such as weight management program, parental education, and school curriculum are all with low average cost and sufficient evidence to show the potential effectiveness of weight changing, therefore highly cost-effective. In terms of current investment, the UK government only invests less than $1 billion a year, and this only accounts for 1% of the overall social cost of obesity. More invest is needed, especially in understanding the effectiveness of intervention measures when they are applied as part of a comprehensive program. So, from the perspective of a commercial company in the healthcare system like Johnson & Johnson, what could be the motivation for them to invest and fund the relevant prevention program, taking into account that they are usually not profitable? We have managed to find the potential reason and business model that's relevant to this. On the one hand, social obligation. On the other hand, which is by benefiting the public, positive brand image could be established so that customers will recall the company name when they have demand of products with respect to obesity relevant issue. In addition, by investing different weight loss program, companies can acquire experience and expertise of preventing obesity, and some of the solution could be sold to the government as well. There are the current programs done by Johnson & Johnson in preventing child obesity, meaning series 3 forms, including direct involvement, funding valuable program, and non-profitable charity. And those are the examples of each kind, showing Johnson & Johnson's interest of this field from a long time ago. All of the programs have worked successfully in terms of effectiveness in statistics, and some of them even awarded by the government as well. There are a few tips that we found from some of the conclusions of prevention programs that worked well. Program with narrow goals, designed for long term, based on skill building with tracking system and involved with physical activity, generally show the positive effectiveness. And also increase the eating frequency with limited portion, also works quite well. In terms of recent actions have been done by some main players in the obesity market. Boston Scientific has invested Barrel Nova, which is a weight loss device company, with $27.3 million. And the other point that should be noticed is that Seung, which is the medical company, even make a loss for last few years, but still invest considerably money in the obesity market and announced their trial statistics for obesity management experiment. Therefore, this market is going to be very competitive both now and in the future. In terms of the attitude of people toward obesity, dealing solutions, and the main companies in the industry, we used quick tools to run the sentiment search. This is the outcome. It is quite clear that roughly the same positive and the negative assessment appears at the same time for both Johnson & Johnson and other medical companies, which means none of the companies has occupied dominant position in terms of social awareness recently. And from the timeline of obesity-related programs, we can see not a lot of programs have been mentioned before 2013. A lot of programs starts in the recent 3 years. Therefore, prevention is definitely a market that Johnson & Johnson should pay more attention to and maintain their position in this field.